Anyone wishing to testify can come sign up right here, please. Thank you.
Yeah.
Is there an agenda or something?
Apparently not.
Let's see. Yeah. You don't have to use that word.
Sorry.
I'm signing you up.
Oh, okay.
Order the Health and Human Services Committee. I apologize for the delay. We now have a quorum and a couple to spare in case people have to leave. Chairman Brown has asked to go first, and that is Senate Bill 480, Senator Unterman's bill. Representative Brown.
Chairman Cooper, members of the Health and Human Services Committee, I bring you Senate Bill 480. Unfortunately, Senator Underman is home sick today. We've had some in communications with her. She asked if I would carry this and has given me some coaching. I have some folks here from the Department of Human Resources who is really the requesting group for this. I think you're well aware that we have a real nursing shortage, and it's beginning to be getting to the crisis stage at some of our personal care homes. And what we're faced with, if we don't pass this bill, some of these folks, particularly the developmentally disabled, are going to have to be put into the nursing home. The nursing home is $36,000 a year, and we've got a waiting list as is. And I want to call your attention to several handouts. First, there's a group of letters here of support. I just talked to Demetrius, and I don't want to take words from Demetrius, but indeed the Georgia Board of Nursing is in support here. We have, and I think all of the parties, the Georgia Board of Examiners for Licensed Practical Nurses are here, the Governor's Council on Developmental Disabilities. As I came up in the elevator, I spoke with the Medical Association of Georgia to make sure that they were comfortable with it. And all of those groups, quite frankly, helped to craft this piece of legislation in the Senate, and I think that's certainly a sound type of thing. What we are about in this state is the settlement of Olmstead. And Olmstead really provides for care in the community wherever possible. So yet another advantage of passing this piece of legislation is the fact that we're going to indeed be able to comply. The governor is fully on board with this because it's all part of his remedy, if you will, to the homestead exemption. The homestead settlement. A couple of, you have a little talking point here, and you see those supporters that I went through, but I think there's a couple of key questions posed. Will the qualified medication aid, and that's in essence what this piece of legislation does, it creates that as a category of health care provider under very rigid protocol, if you will. But it will be under a nurse supervisor, and you see the answer there with some detail. The next question, will qualified medication aids work in other settings, such as nursing homes, personal care homes, home health centers? No. This is really quite restricted to the one setting that I mentioned. I'm going to move you very quickly through here, but right now, by the way, we have 350 people waiting, and about 96% of these people, Chairman Cooper and members of the committee, are requiring this ability. Now, normally that would have been provided by an LPN or by a registered nurse, and if this passes, then we'll be able to have that additional group of providers. We are looking at a bill called the Georgia Qualified Medication Aid Act, and what it does is delegate certain activities performed by registered professional nurses and licensed practical nurses to these qualified medication aids. And then moving on, this is basically definitions on page 2 with line 3. And again, the Medical Association really weighed in on this as they're looking at the protocols, et cetera. And then on page 3, starting at line 13, it enumerates the powers of the board. And the board, as I recall, is the same board as the licensed practical nursing, so you don't have to establish yet a separate board. And then as we turn to page 4, you will see the background checks, et cetera, that these people are going to have to go through. You see on line 9 that the course will be conducted by the Department of Technical and Adult Education. There's going to be a board-approved competency exam. They're going to have to maintain certification work under the supervision. I'm reading right now from lines 14 and 15 of page 4 of a registered professional nurse. And then as we get into section 432656, starting on line 19 of page 4, we began to follow the tasks that are permitted activities that may be delegated. So a very specific task, and quite frankly, there was a couple of them, I think epinephrine, if I'm pronouncing that right, not being a medical person, I have a little problem with their Latin, but they did remove that, so I think the list of medications that this group could administer are reduced. And then as you look at section 432658, starting on line 10 of page 5, really all the way almost to the end of the bill, to line 2 of the last page, What you're doing here is the board shall have the authority to refuse or grant a certification and or to remove that certification. So there's a lot in here about the disciplining, the supervision of this group. Chairman Cooper, I'd be more than happy to answer questions. I don't know upon the end of it. I know some people have signed up, but at least those from DHR, they'd be delighted if they didn't have to testify. But I think we have 2 of them that have signed up. That's all I see here. If you
Okay. Huh? Thank you, Chairman Brown. Questions from, are you ready for questions from the committee?
I am.
Okay. Any questions for the chairman from committee members? Pardon? Oh, Representative Carter.
Thank you, Madam Chairperson. I just wanted to make certain that I understand the limitations that will be on these homes. I guess I'm looking at, or I should say, what the community living arrangements, the definition is. On page 2, starting at line 8,
Yes.
and then it goes on at the bottom about line 13 to say, and whose services are financially supported in whole or part by funds authorized through the Division of Mental Health, Developmental Disabilities, and Addictive Diseases of the Department of Human Resources. So essentially this means that they would have to be funded through the state, whether it be profit or nonprofit, before they'd be eligible to participate in this program.
That is correct. And that's where our crisis is beginning to build, because these people can't afford a licensed practical nurse or a registered nurse, and really more so than affording it, it's the availability of same.
Right. Okay.
Other questions for Chairman Brown? Representative Jennings.
Thank you, Madam Chairman. Chairman Brown, I just noticing the letter of support from Nurse Linda Herron refers to this as a pilot project. Is this a pilot project, or has that changed in the progress of the legislation preparation?
It is and it isn't. One, there's a sunset provision for it. Secondly, this legislative body has the right to revoke it at any time. And thirdly, the department itself, and that's what I was referring to, that almost last third of the entire bill, if they find enough discipline problems, believe me, they're going to be the ones to pull the plug, because that exposes the state. So I wouldn't call it is a start, and we're all going to watch it. Have I answered your question?
I guess you're telling me it's progressed maybe beyond maybe an original idea, thinking that they would set a short term on it.
Well, we have a sunset, as I recall, of 2011, and all of the other things I said. There is a little bit of objection, and I think that the letters of endorsement, and this is one of the things as I talked with Demetrius, I think there's a clear expectation this is a trial, and I think that we need to adopt it in that regard. But some, particularly in the executive branch, have a little problem with the word pilot. And so we didn't want to get this vetoed, to be quite frank with you.
Thank you.
Other questions? Representative Watson.
Yes. Thank you, Madam Chairperson. I just want to ask Chairman Brown, what other states have taken on this and doing a great job with this in their areas, I guess? Any other states we have a record of?
Yeah. Mary Lou, would you introduce yourself? And share? Is that okay?
Yes, right, certainly.
Okay, thank
Thank
you.
you.
My name is Mary Lou Ron. I work for the Division of Mental Health, Department of Human Resources. We did do a national scan to see what is out there. There's 28 states currently on record that you can locate through the internet that actually have a classification known as medication aid of some sort, working in under different governments within the state. In terms of the southern states, Texas would be our nearest neighbor that has this program. So briefly, there are 28 states that have this as an active category of health care, with 3 more, not counting Georgia, that are under study.
The
Yes,
second
sure.
part.
Representative Watson.
Thank you so much for that. The second part, I know you had a sunset of 2011 on here on the bill. What are we doing, Mr. Chairman, as a legislative body to increase awareness for the need for nurses in our technical colleges and our 2-year institutions and even our 4-year institutions? Since we're going to have a sunset of 2009, is there any work afoot right now to make sure that we can help with the shortages? through our educational institutions?
There's a number of things. We put some extra funding in. The tentative budget has got a long way to go yet. It has to get out of the Senate and through conference for Mercer. One of the things that Mercer has is an agreement with Piedmont Hospital for the training of 200 brand new nurses. There's been some legislation we as a House have passed in that regard. I feel fairly comfortable that we are doing what we need to be doing to address the problem. Certainly organizations like AHEC, et cetera, are out there. I know my own LaGrange College, which has a BSRN program, even as the private sector is expanding there.
I want to make sure we're doing it because I know that Georgia Parental College and other colleges where we have these institutions funding has been a great problem with the nursing shortage in Georgia. And at some point, I just thought that our agency and our legislative body should address, funding for education to entice nurses to go into the program.
There was one program in Chairman Smith's area of Regents where one of them wanted to withdraw some funding for the nurse practitioner. I think all of those monies have been restored. I mean, I'm caught me a little off guard, but I think if I came to you, I could double the list easily of specific things we've done.
All right. That's very good. Thank you.
Thank you, Representative Watson. Representative Reinders.
Well, thank you, Madam Chair, and thank you, Chairman Brown, for carrying this. I thought just on our last conversation real quick, just to put it on your radar screen, there are many two-year colleges that have put in, when given the opportunity, to change the mission statement to be able to offer nursing degrees and expand their services to 4 years. Some of these, I can tell you from firsthand, are in some of our most underserved areas. And I certainly would look forward to working and talking with you in the future about how we can do to make sure that we get the proper utilization of the nurses in those underserved areas. In regards to the bill specifically, I just want to make sure I understand you. For that small personal care home or group home, with 6, 8, I think up to 15 is the number, we're not asking for them to have to go out and hire a medication aide or anything like that. We're not going to come in after we lay this legislation in 3 years from now and 2 years from now and say we need it then when it seems to be working with what they're doing right now. Is that my understanding?
I don't quite understand the question. Maybe, I'm sorry.
Well, I got some no's shaking here, so I understand that that's not the intent.
Go ahead. All right.
Currently, they don't have to do that.
I'm Roberta Schulte, and I'm also...
You'll please identify yourself and who you're with.
Okay, yes. I'm Roberta Schulte, and I'm with the Department of Human Resources, Division of Mental Health, Developmental Disabilities, and Addictive Diseases. And the way this bill is crafted is it does not go into your regular personal care homes or nursing homes or group homes. There is a specific, as you pointed out earlier, category of living arrangements called community living arrangements that's established just to serve our consumers and primarily folks with mental retardation. And they cannot have more than 6 consumers in the home, although if they're getting some Medicaid funding, I believe they can't have more than 4. So they are very small and scattered throughout the state, and the applicability of this legislation is only to them.
Thank you so much.
Okay.
Representative Carter.
Just one final question, Representative Brown, if you will. On page 3 at the top, where you've got a registered professional nurse or a licensed practical nurse may delegate certain nursing tasks to no more than 15 qualified medication aides, was there a rhyme or reason to the 15?
It was my understanding that it was 10, and some of the, MAG apparently raised it to 15.
For what reason? Just...
Why don't you introduce?
All right, Mary Lou Ron again. We try to look at the number of people that might be working in 1 or 2 homes who would have this responsibility, and what is reasonable in terms of having one RN be able to track and follow and be safe with the number of people that she's supervising. And so we settled on this number 15, that was a reasonable ratio of personnel for them to keep up with and still have very safe practice.
Is that pretty consistent throughout the states that do have this?
My general answer would be yes, but to be specific state to state, I couldn't say.
Thank you, Madam Chair.
I have a question. You might want to ask me. How are these medications going to be prepared? Are we going to have it just like a regular person has, 60 thyroid tablets, and they'll be dispensing them that way, or will they be like they're in a nursing home where they're individual, packeted on an individual basis?
In general, within these homes, most of their medications do come in the prepackaged mode.
Okay.
They don't have to. In general, they do, though. Now, if I may also add one more point, in terms of how these folks will be taught, what we have done is work with DTAE and looked at the current courses that they teach now. We've taken the medication administration course that is taught to LPNs, backed out those parts that we don't want these folks to do, and they will be taught those very same course methods and instruction.
Other questions from, yeah, oh, I'm sorry, Representative Henson. Do you have a button? Did you have your,
Yeah, I did.
okay, we got it. Are we fine?
I'm sort of curious about the 15 aides under an RN, and yet we're the same body that decided a physician could only supervise 4 physician assistants or 4 nurse practitioners. Is that correct? Why are we giving such a greater ratio to registered nurses than we gave to physicians and, advanced practice nurses and physician assistants?
My answer to that is that what you are creating in this category is a very minimal level of providing health care. If these people did not have their mental retardation, quite frankly, they would be self-medicated. But because of this one thing, they can't. So that's a very elementary step. You have all types of protocol. Whereas with advanced practice nurses, if that bill were to pass, and certainly with PAs that has already passed, you're absolutely correct in those ratios. But that you're into prescribing now. I mean, we're way back from that. And so my feeling is that with the weight restrictions, with the protocol in place, that this is certainly a manageable number.
Can I follow up? You've mentioned, and I've heard it mentioned before, about mental retardation. I haven't finished reading this bill, but I didn't realize that all people in personal care homes or community settings had a mental retardation, and yet you keep referring to a mental retardation. Could you tell me where this applies only to people with mental retardations?
Sure.
All right. If I might explain, there are 2 categories of licenses that most of our folks who our monies go to live under. One license category would be personal care homes. Those folks are really rather independent for the most part. They don't have any caps in terms of the numbers of people that can live in that home. They are supposed to be ambulatory folks who really can care for themselves. This class that's known as community living arrangements was created probably about 6 years ago as a separate category of license. Within personal care home, the rules of the personal care homes regulations actually drive the care that is permitted within those homes. Under the community living arrangement rules, the individualized plan for each person drives their particular care that is given. It is written in our regulations within our division and within Medicaid for the MRDD waiver that only 4 people may live in a home if they have mental retardation or developmental disability. So it's a different level of care, much more individualized, and they can be much more compromised, if you will, in terms of their ability to care for themselves.
But are we therefore having qualified medication aids only for folks with mental disabilities?
For the purpose of this
retardation?
For the purpose of this bill, it would be strictly for those persons living within community living arrangements. We would pull from the staff already in these homes, train them for this function, assuming that they pass, they would go back and work within these homes. And for the purpose of the bill, it is strictly applicable to that category.
Oh, it's not going.
And lastly, I have one last question. I noticed that you put in they have to be able to read, write, speak, and understand the English language. But yet, in some cases, you're going to have them working with folks who don't speak English. I assume the English is possibly for instructions of medication, but could you take that a little further? Because I feel that sometimes they're going to need to be bilingual.
Right. This does not
But no.
exclude someone being bilingual and working with folks who are bilingual, but for the purpose of coming in and learning the content, becoming competent and certified, clearly we want them to read, write, and understand and be able to speak the English language. And they will be tested in the English language, too, for competency.
But to what degree, what grade level would you be looking for? Because, I mean, seriously, if they are going to be working with folks who don't speak English,
What grade level?
I mean, I understand there's some necessity for them to speak English, but I also realize the important thing is the communication with the patient base that they're going to be interacting with. And this is a problem that we encounter in DeKalb at times, with needing someone that can speak another language to be able to interact with the patient. So I'm also concerned with the communication level with the patients
Right.
that they'll be having.
If I could perhaps just redirect a little bit, what you would more commonly find in these homes are folks who have difficulty speaking, period. Folks who have much difficulty with expressive language, who might have to use boards, signs, other forms of getting their needs across. Part of what these medication aids will be taught is about the characteristics of the people that they will be working with and how to work with that, how to learn about those cues and so forth.
Representative Henson, thank you very much. Let me answer 2 questions for you. There's a great deal of difference between dispensing a medication and diagnosis and prescribing a medication that an advanced practice nurse would do. Also, as a former nursing faculty member, the kind of things that are being allowed by these technicians are sort of the things that freshman nursing students do, and under a supervision of an RN. And what you need to understand is the written order, what the medication is, and the doctor, more than communicating with the patient, because the most important thing when communicating with the patient would be is that they need to take a pill, or they need to have their finger stuck, or that type of information. So, Representative Dotson.
Thank you, Madam Chairman. Chairman Brown, on this 15 qualified medication aids, seems to be some question. These community living homes are 24 hours a day, 7 days a week, aren't they? So you have a turnover in personnel, and so I think that would help add to the number that needs to be qualified. And then probably one nurse may have more than one home that they're working with, so I think the 15 is a very reasonable number. So.
Thank you, Representative Dodson.
Okay. Representative Reiners.
Thank you, Madam Chair. I'd like to be recognized for a motion to pass.
Okay, we have a motion and a second that Senate Bill 480 pass. Do we have any more discussion? I did have one question. Which committee did this pass out of in the Senate?
Dr. Thomas's, and I think Dr. Thomas, it was unanimous, and it did pass unanimously in the Senate itself.
My esteemed colleague in the legislature and the senator. So this bill has been through that Health and Human Services Committee also. All right? Any other discussion? All right. Everyone in favor of Senate Bill 480, please signify by saying aye. Aye. Everybody opposed? The ayes certainly have it, but it's unanimous. Thank you very much, Chairman.
Chairman Cooper and members of the committee, I thank you, and I thank you for your good questions.
Say like that. Okay. We've got Senate Bill 507, and if our committee could welcome Dr. Thomas from the Senate side. Glad to have you with us, Senator Thomas.
Thank you. Senate Bill 507. The purpose of this bill is to increase the number of physicians in underserved rural areas, and it makes loans to physicians who have completed their medical education and allowing such loans to be repaid by such physicians agreeing to practice medicine in such rural areas. It passed out of Health and Human Services unanimously and also passed the Senate unanimously.
Okay. questions of the committee for Senator Thomas? Okay, Representative.
Just because of the previous bill, thank you so much, Madam Chairperson. Just because of the previous bill, why won't we do this for the nurses in the rural areas?
I have no objection to doing
Okay.
it for nurses.
I mean, I'm just thinking out loud. We just had a bill about, shortages and, I just looked at the bill.
Have no objection to a similar bill doing that.
Huh? We do have Representative Dodson. Go ahead and say. Representative Dodson.
I think that's being done, but not legislatively.
Exactly.
So, I don't think we need a bill. And sometimes a hospital gets hung up on or our area gets hung up on this type of thing. So, but for the nurses, no, we offer a lot of things through the medical centers.
Thank you, Mr. Dodson.
So, Representative Smith.
Madam Chairman, having served a rural area, I can tell you this is a very needed piece of legislation, and at the proper time, I'd like to move to pass.
All right. Is there any other discussion? Questions from the nurse? Okay, Tokus?
Dr. Thomas, how long will the physician be required, for lack of a better word, stay in the rural area? Is this, until the loan is repaid?
It's year for year of training, so it'll be 3 years.
3 years. Okay. Thank you.
I overlooked asking on the last bill if there was anybody from the audience that wanted to speak on the last bill. However, I think people are usually pretty good at coming forward. If they did, I hope I didn't miss anybody. So is there anybody from the audience that would like to speak on this bill that has not signed up? Thank you. Any other questions from the committee? All right. What's the committee's wish? Okay, Representative Smith. Thank you. Okay, any discussion? Further discussion? Okay, all in favor of a do pass, say aye. Aye. Any opposed? Okay, Dr. Thomas, it passes unanimously. Okay, House Bill 507. Senate Bill 507. That was it. Sorry, what am I looking at? 785. Senate Resolution 785. I'm tired and it's time to go home.
Yes, Senator Johnson asked me to present this resolution creating a joint comprehensive state trauma services study committee, and interest from Senator Johnson grew out of the murder of Jennifer Ross there on the streets of Savannah, where she was left bleeding, but due to the excellent trauma care, her family did get to hang on to her for 7 days before she died. They have an excellent trauma center there, and in some other areas of the states, some areas of the states are very lacking in trauma care, and the aim of this bill is to study this issue and help correct it, see what legislation might be appropriate. The Speaker would appoint 5 members to this committee. The Senate Pro Tem would appoint 5, and then each would designate one as co-chair, and they will study the issues impacting trauma care in Georgia and recommend actions and legislation, as I said. They will meet for not more than 5 days, and the report will be due, and the committee will be dissolved December 31st, 2006.
Okay. Questions for Dr. Thomas? Representative Smith? Oh, Representative Carter, sorry.
Madam Chair, at the appropriate time, I'd like to make a motion to do pass.
Oh, somebody else? Is there other questions from? Oh, I'm sorry, Representative Smith. Brown.
Thank you, Chairman Cooper. Chairman Thomas, I applaud Senator Johnson, you for bringing it forward. We have a crisis in this state, and I think we began to we've recognized it for a while. We started to do something specific in the House budget, and I hope the Senate will at least keep that $4 million in there and hopefully add to it. It's a drop in the bucket, but this is also a good start, so I applaud the Senate on this resolution.
I agree with you.
Any other questions? Not, everyone in favor of Senate Resolution, so we already had a motion, I need a motion and a second. Thank you. All right, no other further comments? Everybody in favor of Senate Resolution 785, say aye. Aye. Anyone opposed? It carries unanimously. Senate, thank you very much for coming, Dr. Thomas. I do want to take this opportunity before we break to assign Senate Bill 422 to our Scope Subcommittee, which is chaired by Representative Jennings. So that's Senate Bill 422. I want to thank the committee members that attended and staying with us today on an afternoon when they could be heading to South Georgia. Thank you very much for that. We may actually, you will know, we had some bills. Senator Unterman went home sick. There was a question about another one. So just in case I need to call you before next Thursday, please be advised that we may have to, but so far we will not be having a full committee until next Thursday. Thank you again, and I will say we do have a terrible nursing shortage in the state. I think it's something that Chairman Brown and that both of us would like to work on, and that you have my commitment that I will see if we can't do that, the two of us together, to encourage more nurses across the state of Georgia. Thank you very much, and the committee is adjourned.